we think that brain measurement can be part of screenings and preventative health. We provide a very robust and scalable, easy to use, accessible technique to look at the functional part of what's happening in the brain.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster. We're here at the Alzheimer's Association International Conference, AAIC, and I'm with Ryan Field, CEO and CTO of Kernel. Ryan, great to see you.
It's good to see you, Logan.
You joined the Startup Health Alzheimer's Moonshot not too long ago. When was that?
It was in May.
It was in May, okay.
We're about 2 months in, yeah.
Awesome. I want to hear all about Kernel. Your product, you have a piece of hardware.
That's right.
Which is actually not typical. A lot of folks are working in AI and software, but you've got a piece of hardware and it's got an interesting form factor. So describe to me what the Kernel helmet is.
Yeah, so Kernel is and always has been really about brain measurement.
Okay.
So when we started, the goal was, can we build technology to measure the brain? And so we did. We spent about 5 years developing brand new measurement system to measure brain function and other properties of the brain.
When you say new measurement system,
yeah,
how separate from like the EEG sort of paradigm that we're used to?
Completely different.
Okay.
So if you know what a pulse oximeter is, a lot of smartwatches today have these sensors in them that measure your blood oxygenation. We all know from COVID what a pulse ox is now. Like, you know, we measure our blood.
Does it use like infrared or something?
Exactly. And so you can kind of imagine taking those and tiling them over the head to make a map of oxygen.
Oh.
And so the helmet we have maps out the oxygen in your brain and how it changes over time.
Huh.
And that's really interesting because if we remember back to Biology 101, for cells to do work to metabolize the energy, they need oxygen. And so we can see where these local changes in oxygen are happening. It's a well understood phenomenon. Techniques like fMRI are based on it. They're kind of leveraging similar biophysical principles.
Okay.
But we use light to get at that same signature in a kind of scalable, portable, really accessible way.
So why, okay, you compared it to fMRI. I'm not an expert in fMRI, but you said there's some similarities.
Yes.
Why create a new modality? Why not just do fMRI?
Well, because, we think that fMRI is a great research tool, and it's done so much great research over the, decades it's been around, but the problem is it's not a good clinical tool. You're never going to go to your physician, hop in a scanner as part of your annual checkup, and
out of curiosity.
Yeah, right. Like maybe out of curiosity, but that's not going to be a routine part of care.
No.
It's too expensive. The systems are too complex. And so we really wanted to build something that could be used in more point of care settings where patients already are.
Okay.
We don't want brain measurement to only be thought of when there's a problem and something's gone wrong. We think that brain measurement can be part of screening and identifying things and preventative health. But if you don't know anything about what's going on in your brain, you can't do anything to prevent it.
So does that mean that your method is a lot cheaper?
Much cheaper, much cheaper. So, 100 times cheaper
than
fMRI.
Than
fMRI, yeah.
Okay.
So.
And you were able to do it in, like, if it's a helmet, it seems like you can do it almost anywhere.
Yeah, that's true. Actually, I was here at AAIC yesterday. I had it in my backpack all day. So I was doing demos at the lunch tables for folks that were interested.
What does a demo of Kernel look like?
You put it on, you wear it for about 3 minutes, and we can generate a report that just tells you some general metrics about your brain. Nothing clinical today, but just information about what your brain is doing and overall measurements related to it. So.
And the alternative prior would have been either a big MRI machine, expensive, or covering your head with electrodes of some kind?
Yeah. So EEG, EEG has its own benefits. It's like, a slightly different type of signal, but you're really measuring brain function again.
Okay.
And so it's like EEG and our technology are kind of two different ways of measuring brain function. And fMRI is another way of measuring brain function. And so we do measurements of brain function and look for signatures that something is abnormal in that brain function.
Okay.
And that's all about kind of the work we were presenting here at AAIC, was showing that we could...
You presented something today?
We presented yesterday.
Okay.
We shared a poster, and that was results from our first pilot study looking at mild cognitive impairment.
Okay.
So we just enrolled the last patient in June. Last data collection was done in June. And put together results for this conference. This was the first time we shared publicly that we could take measurements from the brain in about 10 minutes and identify patients who have MCI versus healthy. With 80% accuracy. So in 10 minutes, we can do as well as a multi-hour neuropsychiatric exam and extended workup.
Okay.
And so we think that's really a powerful starting place to build something much bigger for the future, and something that can ultimately get into like regular clinical practice. That's where we want to be. And so we're going down kind of a path of replicating the science, approaching the regulatory and reimbursement agencies, and then working to kind of bring this to market as a new tool.
So put your futurist hat on, your Kernel helmet. Looking down 5 years from now, if this all kind of goes as you have planned, who do you see deploying the hardware, and kind of how do you see those initial visits about mild cognitive impairment being different?
Yeah, so I think we'd probably start in specialist centers, like providing additional measures that neurologists can use to get to the same answers faster. Right, I think that would be a big win, because we already know there's a shortage of neurologists. Capacity is completely filled.
So the neurology office would purchase a few of these and just have them ready to go.
And they could get answers about who is likely to have the types of problems that are related to mild cognitive impairment. So it could be MCI due to AD or other types of dementia. So it's not specific to Alzheimer's. It's more general about changes in cognition. So I think 5 years down the road, we'd love to be in these specialist centers, helping them be more efficient in screening and seeing patients. And I think this is going to be really important, especially with new treatments coming online. There's going to be a higher demand for these specialists, and we have to find a way to make them more efficient. And I know there are the plasma biomarkers that are coming out as one kind of tool that they'll have in their tool belt, and we think this could be another valuable tool in their tool belt to really help identify the right patients who need to see need to have more care, need to have follow-up measurements done.
You bring up an interesting point in terms of the multifaceted nature of the biomarkers that we're seeing. How do you see Kernel sort of playing in an ecosystem of tools?
Yeah, I mean, I'm a believer in that the future is all about multimodal measurements, right? Like if you look at a relatively simple organ like the heart, right? Even when you're looking at heart disease today, you're not looking at just your lipid panel from the blood test. You're looking at your lipid panel, perhaps a stress test, angiogram, like looking at the vessels. So there are all these different measures that are used to understand what's going on with the heart so it can be better diagnosed and treated. And to think that the brain can be diagnosed with fewer measures or with a single data point, I think is, history kind of suggests that it won't be the case. And so I think where we fit in is we provide a very robust and scalable, easy to use, accessible technique to look at the functional part of what's happening in the brain. In addition to, obviously the plasma biomarkers, and you've got other imaging tools like MRI that, I think will still be used as part of care, but it's going to be this kind of multimodal, hierarchical way of looking at the brain and, adding tests as you need to kind of dig deeper and understand more about what's going on.
So what's next for Kernel? I'm assuming this is a capital intense business to scale.
That's right.
And so where are you at in that process?
Yeah, so we closed around last fall. Thanks. So we closed around. I'm taking in a little bit more capital in the coming months, just an extension of that round. And then probably about this time next year, we'll be looking to raise a new priced round following our next scientific objective, which is really replicating the results that we're presenting here at AAIC. We believe in doing really good science and building, laying a good foundation and then building on it. And so we think that we've done a lot of the good foundational work, and we want to show that, what we did is reproducible and can be done in different settings, another cohort of patients, and do a little bit more on retest reliability, looking at things that really provide confidence that the measure we have is meaningful and accurate and will ultimately be helpful in the clinical setting.
What kind of partner, investor, strategic partner would be like a real unlock for you?
Yeah, I mean, anyone who cares about brain health generally, I think is a good starting point there. So we love clinicians who are motivated to treat their patients better, who care about brain health, who are early adopters, are curious about new technologies and want to do whatever they can to understand their patients and improve their lives. So all for those types of people. Investors, we love people who are mission aligned. If there's a strategic interest, we're I'd be happy to have those types of people, people who can either join the board or join as advisors and really help navigate a very complex system, as we all know, right? Like, the healthcare system is difficult, the brain is difficult, so we're like, reimbursement's difficult, so we're just like navigating so many difficult spaces in parallel that having great advisors and great partners to come along with us is really important to me.
Kind of where you're at right now, you've done so much work to date, this 5 years of development of this piece of hardware, and yet now there's this new mountain to climb in terms of scaling and commercializing, and it's going to be an exciting couple years.
Yeah.
And we'll be watching what you do next.
Yeah, and I'm really excited to be part of the startup health ecosystem, because I think that's going to be invaluable as we climb this mountain. Just having a bunch of other startups who have gone through it or are going through it together with us. I'm really looking forward to it. So.
Have you had any specific experiences so far where you've sort of felt the power of that community?
Just like very initial, like the sparks of those things, I think. I'm only 2 months in, so still getting acquainted with the ecosystem, but I can see examples of others and how it's kind of helped to get things going there.
Awesome.
So.
Well, Ryan, thank you for the update, and we'll be watching you for what's to come in the next 12 months.
Yeah, okay, great.
Take care.
Thanks, Logan.